So again, thank you all for attending our training this afternoon. Just a few housekeeping rules, if you will, or housekeeping guidance. To stay on mute. We will have an opportunity for you to ask questions at the end, but feel free to also put them in the chat as we're going along. And feel free to, at that point, at the end, when we open up for questions, to just engage with us directly. And we also have closed captioning for this training. So if there's an option on your toolbar to enable that if you're not seeing it currently. So I will introduce our speakers and then have them take it away. So first up, we have a full roster today. I'm very excited about this. It's almost like a dream team roster. We have Alice Bonner with the Institute for Healthcare Improvement. We're gonna get Megan back on the line, and she will be presenting on behalf of Trust America's Health. Dr. Kathy Black with University of South Florida, my wonderful alma mater. Jody Shu with the Age Friendly Institute. And Bryn Bowman with the Center to Advance Palliative Care. And with that, I'm actually going to stop sharing the slides and let Alice Bonner take it away.
Okay, that's great. Thank you so much, and welcome everybody. It's always terrific to be part of these training webinars, and just really glad. I just want to start by saying thank you for all the work that all of you do every day at the point of care, in research, education, as clinicians, policymakers, public health workers, everything that you do. I'm very glad to be here today. My background is I was a clinician. I was a nurse practitioner for, almost 30 years working with older people across different settings. And in the last 10 years, I moved from being at that clinical, point of care to being in policy roles in state government, in federal government, in private practices. And I am very, very interested in age-friendly public health because, at heart, I am a public health nurse, and that's what brings me to these conversations. Taking the experience that each one of us has in our lives professionally, the work that we've done, whatever that work is, bringing that work to the policy arena where you're now starting to say, or for years you've been saying, how could we make the policy better? How could we change the legislation, the regulations, the public health aspects of how we approach, care and services and programs and support for older people across all the settings where they live and work and play. That's what I'm interested in, and I suspect what you are interested in too. And what's so wonderful about TIFA, Trust for America's Health, and the John A. Hartford Foundation that really supports a lot of this work is thinking about the ecosystem. So, if we're doing work together and we're trying to really improve people's lives, people don't, chop their lives up into, my healthcare's over here and my education's over here and my sports and athletics or my music are over here. It's like, that's all part of who we are as a person, as a human being. And same thing at the community level. We don't chop up, or we shouldn't chop up, cities and towns and communities and say, oh, the healthcare people, they're over there. They just talk to the other healthcare people. And university educator people, they just talk to the other educators. We've done that for years, probably for centuries. And it's time to take a step back now and say, okay, for whatever reasons that happened, it happened, and this is where we are right now. And how do we get beyond that? How do we get from where we are to a point where people are out of their silos and they've come together to collaborate, to think together, to really be thought partners, and to create this ecosystem. So what's an ecosystem? It is an integration of all of the different sectors that I just mentioned. And it's where people come together and speak a common language, and they align their aims and their goals with the aims and goals of lots of other types of organizations. And again, I'm not going to go into more detail because you're going to hear from Jody Shu and Kathy Black and Megan Wolf, who all have tremendous expertise in those ecosystem models. But that's what's I think is important for all of us, is we have to be willing to say, this is a problem. People are working in silos. They're not communicating. And certainly with COVID-19 and the pandemic, a lot of people, I would put myself in that group, think that it's gotten worse because of the social isolation and everybody working remotely. And we're on calls like this, right? Instead of being in the office and seeing our colleagues. So that's, kind of the theme that I want to, leave you with today. But, the idea of ecosystems is that people collaborate. They share ideas. So something that worked in a community college environment, or something that worked in a nursing home, or something that worked in a research lab, some of these things will come together and actually will be able to share strategies, share practices, so that so that all of us are not reinventing and doing, the same thing over and over. One of the things that I did want to talk about today, just briefly, is age-friendly health systems. And I believe that a lot of you on this call know about age-friendly health systems and age-friendly public health systems. And, I'm sure you're going to hear from others today about projects such as the one in Michigan right now, where we're trying to, again, formulate what would it look like if age-friendly health systems and age-friendly public health systems, came together and were really well aligned, and the goals and the missions were aligned as well. So I chatted in a link to the Institute for Healthcare Improvement. If you think your organization, after listening today and getting other materials online or going to our website, if you think you might even be interested in learning more, go to the IHI website, where it talks about action communities. Action communities are 7-month stretches where, maybe 100 organizations get together, they sign up. And sign up is open now for the March Action Community. And again, people think, well, what do we need to do to become an age-friendly hospital, nursing home, ambulatory practice, convenient care clinic? Those are all recognized types of sites right now within health systems. And, age-friendly health systems is about the 4 M's, as you know: what matters, medications, mentation or the mind, and mobility. And so those are threaded across all of the aspects of age-friendly. So again, it's a way to hopefully improve and streamline workflows, help staff and teams be able to deliver the care they want to in a way that supports them to do that, and helps patients or residents or people in the community to be able to live their lives the way they want to. So again, that's a very quick and dirty on age-friendly health systems, and I know you're going to hear some more about that. Tiffany said she's wondering about sharing the link. It's posted in the chat, so it's the very first thing in the chat. We can put it in again for you. The other thing that I wanted to mention was just 3 initiatives that have been going on for the last couple of years, particularly during the pandemic, or they were influenced by the pandemic as kind of a trigger point. And the first one I'll talk about is daily huddles in nursing homes. But I want to be clear that daily huddles can happen in any care setting, and I would imagine some of you already do daily huddles, or you have done them. And I would love if you would chat in that you've implemented daily huddles and how it's been going for you. That's great. You might say, oh, they were terrible, they didn't really work. Or you might say, oh, they were the best thing ever. People are communicating, etc. So in nursing homes, we, IHI and the John A. Hartford Foundation and TIFA and CDC and lots of other partners got together every day for several months. And we had just 20 minutes with a group of nursing homes. And in that 20 minutes, we had the CDC present a data update. We had groups like TIFA and other professional associations talk about policy changes. And then we had people like many of you, your organizations, bringing expertise. Kathy Black, I think you might have been one of those people who presented. So a lot of presentations were just 8 minutes long about the best practices. And it was really received positively. And people took the idea and they started doing the daily huddles on their own in their nursing home without organizations like IHI leading the group. So those are, that's a way to demonstrate impact, in that we reached several hundred nursing homes. We had almost 2,000 signed up, And then each day we'd have about, a couple of hundred that would join the calls. But a lot of those nursing homes actually went on to continue this on their own. So change in practice, big change in practice that led to, outcomes with older people. The second initiative that was definitely spurred on by the pandemic was Project Echo. You might have heard about it. It's from the University of New Mexico and Dr. Sanjeev Arora, which they do Project Echo all over the world, not just in nursing homes, but this was a nursing home initiative that involved over 9,000 nursing homes. So you probably know there's about 15,000 nursing homes in the United States. And so we had over half the nursing homes join Project Echo. And this was once a week. We had about an hour on the telephone with the nursing homes and quality improvement coaches, quality improvement experts, local experts in infectious disease. And the focus was really all on COVID-19 prevention, management, reducing the spread, et cetera. So over these 16 weeks, the nursing homes, which received a very small incentive payment, really figured out ways to implement strategies. We worked with Pathway Health. They're an organization that developed a curriculum. We worked with AHRQ. They had the funding. They have a tremendously detailed website. So if you're interested in anything about COVID-19 in nursing homes, go to the AHRQ website on Project Echo and you will find lots and lots of resources. So that was another example where people continued even after the initiative ended. And then the final thing I just wanted to share is we just finished 6 months of work with a series of 6 nursing homes on prototyping of how do you implement the 4 M's in a nursing home? Because a nursing home is a different environment than a hospital or an ambulatory practice. We all know that. But IHI didn't really have tools and resources that were specifically designed for nursing homes. So we said, well, let's go ask some nursing homes. And, we got nursing homes from all over the country, really good geographic distribution, paying attention to equity, making sure we had, racial and ethnic diversity, et cetera. And we got on the phone with them literally every week for 30 minutes and asked them about, okay, what did you do for mobility this week? Okay, what did you do for medications this week? How do you interact with your pharmacist? How do they identify high-risk medications? All the things that, again, we do in Age Friendly. And, in the beginning, the nursing homes were like, oh, we can do this. We already do a lot of this. And that was great. And it was true in some cases. But every single one of the 6 nursing homes figured out that they actually had lots of opportunities that they were going to take advantage of to do things even better, even when they were doing a good job with all 4 M's. So we learned a ton, the nursing homes learned a ton, and I spend a lot of my time now updating the guide for nursing homes along with our team. We have several people on the Age Friendly team. So I could keep talking, but I'm not going to do that because you have a lot of other excellent speakers. And I just want to wrap up by saying, whatever we do together collaboratively, we want to include age-friendly health systems, age-friendly public health, and age-friendly communities. And we want to create this sustainable ecosystem so that all care for all people of all ages is age-friendly all the time, consistently and reliably. So if you're interested in anything more, sign up for the Action Community. And with that, I'll turn it back to Megan or Karan.
I'll take it from here, Alice. Thank you. I apologize for a technical glitch. It's never happened to me before at the beginning of a training, but I appreciate Karan and Jane stepping in to introduce this training session today. And thank you, Alice. That was a great overview of age-friendly everything. And I'm looking forward to seeing the connections that are going to be made as a result of this training today. So, I think it's really significant that in this week's news that we learned 800,000 people have died from illness related to COVID-19, and that 1 in 100 are 65 and over. It just makes our work and this topic more relevant and more important than ever. And I am very gratified to be able to that we're ending this monthly series of trainings that we've had all year with this focus on the age-friendly ecosystem. and with this great panel of experts that we have here today that I'm happy to join. And so I'm just going to talk just for a couple minutes about the age-friendly public health system initiative. So many of you have been on these trainings all year. You've heard about it. You're already engaged in it. And I just want to talk about the value a little bit of the collaboration and coordination among all the sectors. So the value of collaboration with public health is that I think that it helps to address the limited capacity that all of our systems and all the sectors are experiencing right now. Public health can also identify gaps in services, but also when public health is at the table with age-friendly health systems, with the community, with palliative care, across the board, we can begin to identify also where there are maybe redundancies in services and begin to streamline what those services can look like and brainstorm new ways to partner together to serve older adults. We were on a call earlier today, Karan and I, with a group of county health practitioners from Florida talking about social isolation, and they were talking about how important it is when the emergency folks, the emergency services are at the table with the AAAs, with public health. You learn together and you can begin to identify, where are those areas of synergy? Where can you support each other? And where can you make sure there are not redundancies? The public health also serves as a great convener. This is a role that public health has had for in my recent memory, and can bring together, all of the different sectors to begin to talk about some of these issues. And we've seen that happen with COVID. Public health also serves as a source of data. And data, of course, public health can't do a whole lot without the data, but also public health can help translate that data and develop messaging to share with age-friendly ecosystem partners and align around community health needs assessments and community health improvement plans, or state assessments and state health improvement plans as well. That data is really important, and there can be some really interesting cross uses of that data when it's made available. And then to contribute based on the data and based on those analyses, to be able to contribute to the interventions that might be developed in partnership with other sectors. So we've seen that happen with the COVID response, and these are just a few examples that we're aware of around vaccine administration, and particularly public health engaging with AAAs and other aging services, with faith-based groups, with health systems, with home-based care providers, to identify older adults and others who are homebound and needed to have vaccines delivered at home. And TIFA has done a whole project this year with additional funding from the Johnny Hartford Foundation. We have resources available on our website, which I won't go into right now, but that is just a really solid example of where public health engaged with all the other sectors to make sure that those who needed the vaccine at home were able to access it. Public health also is coordinating with all the other sectors around social isolation and mental health, which of course have been exacerbated in this era of COVID that we're all living through. There are a lot of interventions that are where folks are working together. We've heard about some telehealth opportunities where maybe a health system can come in and bring the experts, and public health can provide the tablets and the access for older adults who may not have it. So there are a lot of different ways to work together, and we just encourage all of you to be thinking about that, to make sure that if you represent public health, that you get to those tables and that you make those introductions and develop those coalitions and working groups together so that you can really meet the needs of the older adults in your communities as effectively as possible. So I'm going to stop there. We have some really great experts that I really want you to hear from and have time for questions. So next up is our friend, Dr. Kathy Black, who's a professor at the University of South Florida in Public Health and Aging Studies. Kathy is also a preeminent mentor for Florida's age-friendly communities movement, which I think she might focus on today. And so I think, Kathy, you have some slides. So Karan, if you could bring those up, and we will take a look at Kathy's slides. Kathy, take it away.
Yeah, and I just want to say and follow up to Megan, I think, the age-friendly public health system Cs are just terrific roles for leadership. And I just want to echo the terrific work that Alice Bonner has done with her entire career, really connecting policy and practice. And of course, it really dovetails well with public health professionals as chief health strategists, and also with MAP 2.0, which will engage more heavily with policy systems and environments, and also a stronger multi-sector engagement as well. So all this comes together. And next slide, please, Karan, thank you. So yes, I'm going to talk about just briefly about the connection between age-friendly communities, dementia-friendly communities, and public health. Karan, next slide.
One second, technical difficulties.
No worries, no worries. While she's bringing it up, let me just go ahead and remind everybody that the age-friendly community movement is really at least a decade old. Some people would say it began even a little bit before 2010, but it's about 600 strong in the United States, and it's closer to 1,500 internationally. But I want to remind everybody that it started from the World Health Organization, and tenets of active aging were the initial thrust, which really is a big focus on how and where people live. But as you can see, I think you're all familiar with the 8 domains of livability, which I've clustered here as the built, social, and service environment. And they should really resonate with all of you because they are very much aligned with the social determinants of health. And if you can leave that slide up for a minute, Karan. So just very briefly, everybody, and I think, I'm talking to a choir here that probably is well aware, but in the built environment, of course, housing, affordable, accessible housing and supportive housing to help people with daily activities to manage in their homes is associated with life satisfaction and self-esteem. Outdoor spaces, safe, accessible outdoor spaces, walkways, parking areas, parks are helpful for people to participate more fully and associated with improved mental, physical, and social well-being. Transportation, mobility options, reliable, affordable, and safety for pedestrians, cyclists, and road users, of course, is good for prevention of transportation activities and helping access for people to get to medical appointments and anything that they want to do to live fully, as well as just promoting activity. In the social environment, obviously, options for lifelong training and employment and volunteering provide people with meaningful opportunities to live fully every day of their lives. Respect, being treated with respect, which the forums is also so focused on, is so important for people to feel included and be part of life and not segregated in a society that needs to be more age integrated. Social participation, having a range of activities at every price point for people of all abilities, so important. And in the service environment, having access, and particularly we saw with COVID, the need for digital access. It was there before, it's even more now. But helping people navigate the care continuum and anything else they need to live fully. And you're all very well familiar with the community supports and health services, because these are all the things we do from prevention to the end of life, as well as all from aging in the community, as well as across the continuum of care, and all the supports that we provide people. All of these things are important for people's health. And those are really the tenets of the age-friendly community movement. So next slide, Karan. This is a slide from Dementia Friendly. No, not that one. This is a slide from Dementia Friendly America, one of the leaders in the age-friendly community. They're just so terrific in all ways. But look, 1 out of 9 people 65 and older have dementia. 1 out of 3, and I've heard even upwards of that in the mid-80s have dementia. And so how do we create communities so that people with degrees of cognitive impairment and their caregivers can still live and fully interact in their communities? And again, aligned with the domains, as you know, we need outdoor spaces that are easy to navigate with good wayfinding and signage and visible, wayfinding. And housing, how do people maximize living in their home? People with, you can have Alzheimer's disease for upwards of 20 years or more. People are living at home, and many people don't become institutionalized. How do you keep people better living at home? And the house can be a source of that as well. In transportation, there's so much that we can do to help people safely transition from driving, but also for people taking public transportation and other forms. How do drivers interact? Can we create better scheduling? How can we create a world and interaction in the community for people with degrees of cognitive impairment and their caregivers to manage more fully? Same thing with social participation. How do we, just because somebody has dementia doesn't mean that they can't participate in social activities. How do we adapt those? How do we remain dementia positive? It's not a dread, it shouldn't be the dreaded disease. People have it, we need to live with it, but people shouldn't be treated differently because they have dementia. So how do we create an age positive world so that people with dementia are just like everybody else? We're a great diversity of everybody and all abilities. Communication information, how do we break that stigma? How do we still provide information to people about what they need so that they can still access all the services that they need in community life? And same thing about the entire health and community service realm. How do we adapt, inform people who are interacting with people with cognitive impairment and their caregivers to better provide those services? Next slide, Karan. I just want to bring everybody's attention to this terrific, this is from the collaboration between the CDC and the Alzheimer's Association, and it is simply terrific roadmap. I know that Nature just recently awarded some communities to really provide some more support to really apply this. And I hope that, I know 2 of the communities in Florida were some of the awardees on that, and we're looking forward to hearing more about that. But please check that out if you get a chance. And thank you, Karan, and thank you, everybody. And I'll look forward to any questions.
Great, thanks so much, Kathy. Yeah, we're very excited about the Healthy Brain Initiative Roadmap Strategist. I think it's Nassau and Sarasota in Florida, but also there's a community in Massachusetts. I think there's one in Washington, I believe. I can't remember all of them now, but yeah, very excited work. Thank you so much, Kathy. Thank you for all you do as well and your leadership. Next, I'm pleased to introduce Jody Shu, who is the Executive Director of the Age Friendly Institute, which is working to advance age friendly across sectors as well. So Jody, over to you.
Thank you, Megan. Hi, everybody. It's so nice to be here. Thanks for having me. As Megan said, my name's Jody Shu, and I'm the Executive Director of the Boston-based Age Friendly Institute. My hope is to give you a sense today for what we're doing at the Institute, why we do it, and in doing so, help you consider how it aligns with some of the work that you're doing every day out in communities. So really simply, the mission of the Age Friendly Institute is to advance age friendly in all settings. And we do that because we want to help build a truly age friendly world. And I think everybody on this call will agree that this term age friendly, it's been around for about the last 15 years or so, is pretty well adopted. You know, there's providers around the globe that are innovating and creating age-friendly best practices to serve our fast-growing older adult populations. And consumers are starting to pick up on this word as well. We know this is happening, fueled by consumer-facing media in the United States, at least, that's used the term over 300,000 times in just the last 2 years. So we have stakeholder adoption of the term age-friendly, and we're beginning to get an accelerated consumer adoption of the word as well. So thankfully, as this is happening, leaders like all of you from across sectors are mobilizing, developing these age-friendly programs and policies to better serve this rapidly growing demographic. But the challenge is that those programs and policies and how they benefit older adults and their families can be fragmented. It can be hard to access information, can be sometimes unreliable, that information in its age friendliness, and it's often lacking the first person perspectives of the older adults it's meant to serve. In short, the information about these age friendly programs and services isn't consumer friendly. And at the same time, we're dealing with a situation where we know ageism is alive and well, and that encourages complacency in some settings about how we think about the needs and wants of older adults. It's hard at the same time for older adults to know who to trust, how to be heard, And this is all happening, obviously, in the context of the generally and possibly increasingly, if that's possible, fractured media environment and on the heels of a global pandemic. So it's a confusing information landscape for older adults. And that's the first problem we're trying to tackle at the Age Friendly Institute. This next slide. Sorry, I didn't tell you to go to the next slide. Dang, that was the first challenge. Sorry, Karen, that was my fault. So we can go to the next slide. The second challenge that we're trying to address is one that Alice referenced in her remarks, and that is that cities, towns, states, countries, health systems, public health systems, employers, all sorts of stakeholders are mobilizing in these big and exciting ways to address the challenges that we all can see, but the information and shared learnings can be scattered across these silos. So while it's impressive work, and it's so important, the work that's happening to improve the lives of older adults, those efforts aren't always incorporating shared language to describe what it means to be age-friendly. And also they're not coordinating their efforts across those silos, across those settings. So we're saying, is it really possible to have an age-friendly community if you don't have access to age-friendly employment or healthcare or an underlying public health system? Are these sectors talking to one another and aligning their impact in proactive ways? And if not, what could we do about that? Because the siloed approach contributes in a way to the confusing information landscape for older adults that I outlined just a minute ago, but it also obstructs to some extent access to meaningful cross-sector intelligence sharing for providers and stakeholders. So next slide, please. And so thus was born the Age Friendly Institute. We're funded by our partners at the John A. Hartford Foundation, and we're working with partners from across the age-friendly ecosystem to elevate all things age-friendly and to help rise all boats, if you will. And in doing so, to help jumpstart the co-creation of shared strategies for program leaders, providers, and other stakeholders so that we can deliver collective impact. And we have three core pillars of our work at the Age Friendly Institute. The first is consumer-facing, our flagship nonprofit consumer website, agefriendly.org. The second is employer-facing. It's an employer-focused age-friendly certification program known as CAFE, which is short for Certified Age-Friendly Employer. And the third leg is our stakeholder-focused work to co-create and foster this lively and impactful age-friendly ecosystem where we hope to prioritize the voices and insights of older adults. So I'd like to tell you a little bit about each one of these very briefly. So next slide. The first is our flagship initiative, which is agefriendly.org. And I'll throw this in the chat when I'm done. And encourage you all to go check it out if you have a moment. It's a nonprofit, consumer-facing website that provides older adults and their caregivers with curated, trusted content and invites their feedback. So we ask, is your community age-friendly? Is your local hospital? How about your mother's assisted living facility, your employer, or even the local town hall? We've built a ratings and reviews engine that makes collecting the answers to these kinds of questions possible at scale. And what we learn when we listen to older adults has the power, we believe, to inform and transform aging. Essentially, what we're doing here is harnessing the power of the internet to elevate all things age-friendly and build consumer demand for vetted programs and services that truly meet the needs of older adults and their families. And through this, we are looking to empower older adults and their caregivers so they can seek out and insist on age-friendly services and programs in all settings. This is how we're working to accelerate change for the better, by listening to the voices of older adults. Next slide. So today, we have a page on agefriendly.org for every city and town in the United States, all 29,000 of them. Site visitors can search their own communities and share their perspectives about age-friendly programs and services. Or they could use the website to explore other communities that may be of interest for their later years, or perhaps on behalf of an older adult in their family or someone they care for. They can engage with town administrators and promote accountability and authenticity to other users who may be also in search of great places to live, work, and thrive. So where are we going with this site? We've got the 29,000 cities in town. What comes next? In December, mid-December, it's already December, but in about T-minus 4 days, we'll add nearly all 6,000 US hospitals to the site, offering users a chance to begin to tell us what they think about their healthcare experiences as reflected through the lens of age friendliness. The John A. Hartford Foundation has a particular interest in using what we learn to help accelerate adoption of the age-friendly health system movement that it has helped to launch in partnership with the IHI and the AHA and other partners. Soon after, we plan to add nursing homes, assisted living, convenient care clinics, and other sites of care. It's very exciting, it's very labor intensive, and there's a lot to be done. Trust and accountability are at the core of what we're building, and we'd love to hear from you about how we can accelerate awareness of this resource and how what we learn may be valuable in your work. We're a nonprofit. We're pulling together an incredible amount of data from older adults and their caregivers. And our goal is to turn that information around to our partners and help them use it in order to improve upon and continue to build really impactful solutions. Next slide, please. So that's agefriendly.org, and that's consumer facing, although it also is partner facing because we really intend to connect the dots between those two pieces of the puzzle. The second leg of our three-legged stool at the Age Friendly Institute is the Certified Age Friendly Employer Program. It is right now the United States only certification program that identifies organizations committed to being the best places to work for employees 50 plus. Since it was launched in 2005, hundreds of leading companies and organizations have earned the distinction of being recognized as a certified age-friendly employer. It's important because we know that age-friendly employers are critical players in the development of the age-friendly ecosystem that Alice referenced. We're all dreaming of it. So we're delighted to be leading this work and fostering employment frameworks that ensure that the term really means something in the workplace, in addition to meaning something in public health and in health systems and in academia and in communities. We all know that an employment market that works for people of all ages is a critical component of any plan for a post-pandemic revitalization of our workforce. And demographic changes point to big opportunities for businesses that can see the benefit of leveraging a multinational workforce, never mind the benefit for older adults themselves. Next slide, please. Oh, that's a dog, not my slide. I'll keep moving, Karan, while you're bringing that up. But last but not least is our stakeholder focused work. And in it, yeah, next one after that. There we go. This is our stakeholder focused work to foster that lively and impactful age-friendly ecosystem that Alice and also Megan referenced in their remarks. Alice, I know, has a great passion for the age-friendly ecosystem and has been working really tirelessly with us on this for quite a long time, trying to think about how we talk about this in a cohesive, comprehensive, and consistent way, and how we help other stakeholders do the same. So we're working with partners from across the ecosystem, like the age-friendly public health work that you all are leading at TIFA, the age-friendly health systems movement, the age-friendly communities movement, all of you, to help elevate all things age-friendly and jumpstart, as I said, this shared strategies for program leaders, providers, stakeholders, so that we can plan and measure collective impact across our settings, because that really is the promise of the ecosystem in all of our work. As Alice mentioned, it will take what we like to think of as radical collaboration to make this work, and to consider how we can engage and collaborate across sectors, because it's not intuitive all the time to figure out how to do that. And it's not necessarily easy, given everything that we all have on our plates, to pick our heads up and be asking those hard questions about how we can align what we're trying to measure and the impact we're trying to bring to bear. So it's important work and it's very challenging, but We know that we can't build an age-friendly world with only the most powerful organizations in the space or with sectors working independently from each other. We have to do it together, and we have to incorporate the voice of the older adults into that work as well. So we are really working hard to make sure that these three pieces of our work are fostering and fertilizing each other across the board. And we'd love to find ways to make them impactful in the work that you're creating as well. Happy to take any questions, and I'll put into the chat the agefriendly.org website. And if you go there now, you'll see the pages for all the cities and towns that you can look up where you live. And then in another week or so, if you go back, you should be able to start looking for hospitals. So thank you for the opportunity to tell you about our work today, Megan.
Thank you, Jody. Wow, I love that term, radical collaboration. I feel like that is something we can grab hold of and run with.
Yeah.
I'm very excited about that. It was great to hear about the three components of your work and how they fit together as well. Thank you so much. And now we welcome Bryn Bowman, Chief Executive Officer of the Center to Advance Palliative Care. So palliative care may be a newer area for some public health practitioners to think about, but one where we feel that there are some opportunities for valuable collaboration. So Bryn, welcome.
Megan, thank you. And Jody, I feel like after your presentation, I now understand that late afternoon webinars require a surprising cute pet picture so that we're all making it work.
Yeah, thank you, Karan. That was very helpful. I'd like to take credit for having put that in my presentation, but I didn't.
Well, work for me. No, I'm going to spend a few minutes this afternoon trying to make the case that palliative care and the needs of people with serious illness are absolutely relevant to a conversation about the age-friendly ecosystem. So if I can go to the next slide. Thank you. So I represent the Center to Advance Palliative Care. We are a national organization dedicated to increasing the availability of quality healthcare for people living with a serious illness and their families. And we do this work by looking across the country and synthesizing best practices in the care of patients in this population, trying to replicate them through healthcare organizations across the country through training and technical assistance. Next slide, please. I'm going to start by grounding us in, what do I mean by palliative care? And then I will spend a few minutes thinking about what is the experience of serious illness and of palliative care from the perspective of that patient and family, and then zoom out and think a little bit about what does this have to do with an age-friendly ecosystem. But palliative care is a medical specialty practiced by interdisciplinary teams, so spiritual care providers, nurses, social workers, and physicians. And the goal is to provide an added layer of support for people living with a serious illness, whether that means relief of pain and symptoms, all of the stressors that can come along with a serious illness. So it's really focused on improving patient and family quality of life, helping families cope in the context of that serious illness, and it's delivered alongside curative or life-prolonging treatment. So the patient populations that we're talking about who can benefit from palliative care are those who have a curable illness, those who are living with a chronic illness over years, or those who have a progressive or potentially terminal illness. So next slide, please, Karan. So I'd like to tell you about Louise Smith, because I think her story is representative and puts this into context. Louise is 87 years old. She cares for her husband, who is 89, and they live together at home. He is frail and has memory loss, and Louise herself is in continuous pain from a bad knee. So she's considering a knee replacement, hoping to regain function, and she has comorbid early stage heart failure and renal insufficiency. So her case is not outlying or unusual in any way. And Karan, if we can go to the next slide. This is what Louise and her husband are at risk for, given usual care. So she may go to her primary care physician. They may give her ibuprofen for that knee pain, exacerbates the renal insufficiency, and all of these dominoes fall such that she herself has a fall and ends up in the hospital, where she stays for 12 days. In the hospital, she develops a delirium, fecal impaction that exacerbates that delirium, acquires pressure ulcers, and experiences weight loss. So she leaves the hospital more frail and needing more help than when she entered. She's discharged on home health, and she falls again because that knee pain hasn't resolved. And again, she's debilitated after that hospital stay. So she's back in the hospital, this time discharged to a nursing home. Her husband cannot take care of his own needs alone at home. And so he's placed in that same nursing home. And again, we see these dominoes fall. And the end of this story for Louise and her husband is not a happy one. They'd promised each other that they wouldn't end up in the nursing home, and it had been important to them that they stay at home, but they didn't have the support structure in place to avoid those crises and to avoid this outcome. So if we go to the next slide, you can imagine a world in which Louise and her husband had access to palliative care, which was insured through a Medicare Advantage plan that had a system in place to identify Louise as somebody who was at high risk for emergency department visits and for hospitalization. That plan's case manager engaged Louise on the phone to talk about what really mattered to her. In Louise's case, it was staying at home, staying there with her husband so that they would be together and remain independent. The case manager talked to the primary care physician, and they were able to connect Louise and her husband to a home visiting palliative care team. They were able to do a home safety evaluation, help Louise get on physical therapy, install grab bars and other supports in the home to help address that knee pain and improve her function. And they also realize once they're working with this couple that they're socially isolated, that Louise's husband has a hard time getting out of the house and Louise herself is afraid to leave him. And so they help set this couple up with a friendly visitor program from her church. Now, the underlying problem that started all of this bad scenario for Louise had been her knee pain. And the palliative care team are expert at managing symptoms, and so are able to provide her with low-dose opioids needed to manage that pain, put her on a bowel regimen so she's not at risk for opioid-induced constipation, and give her really thorough education about how to safely use those opioids. And with the help of that kind of support, Louise and her husband are able to stay at home. They have a 24/7 number they can call if they're worried about something or have a crisis, and they get continued support from that team. So if we look at the next slide, why is this kind of service needed in the first place? And Karan, I apologize, this might be several clicks of bullet points, and we can just cruise through them all. I think the story illustrates that what too often happens for older adults living with a serious illness is that they don't have the benefit of skilled conversations with their healthcare providers about what really matters to them in the context of a serious illness. We see by the number that large proportions of older adults living with a serious illness are at risk for ending up in the emergency department because of uncontrolled symptoms. Often those visits would have been avoidable if those symptoms were well managed. Caregivers can become exhausted and overwhelmed and often at financial risk because of the strain placed on them from caregiving. And navigating the health system as an older adult with serious illness, exactly as Jody said, is confusing because of fragmentation. And so the goals really of palliative care are to try to address these gaps through skilled communication with patients about their goals of care, to support decision-making that honors care goals and that improves quality of life, to manage symptoms, to avoid those crises, avoid those middle of the night trips to the emergency department, and improve function. Provide education for family caregivers about what to expect if disease progresses or what to do in an emergency, and to help coordinate care across settings. So next slide, please, Karan. So what does this have to do with age-friendly healthcare and especially age-friendly public health? The reality is that a large proportion of older adults will at some point acquire a serious illness or have a serious illness. And so we are not talking about two separate populations with older adults and people with serious illness. This is very much an overlapping Venn diagram. And I think what really connects the foundational principle of the field of palliative care and age-friendly health systems is this concept of what matters to patients, is the goal of honoring patients' wishes and helping patients navigate healthcare decisions such that what matters to them is honored. If we go to the next slide, Karan, think thinking about alignment with age-friendly public health systems, we look at the population of patients with serious illness. It depends on how you operationalize the definition of who is in this population. But estimates range between 12 and 40 million older adults living in the United States today are living with a serious illness. And this number is projected to grow as we live longer with common serious illnesses and as our medical care for many of those diseases improves. And so the goal from the palliative care perspective would be systematic identification of those unmet palliative care needs for patients.
I mean, maybe.
Oops.
Or maybe Santa might.
I think somebody may not be on mute.
Ask everyone to mute, please. Thank you.
Systematic identification of those unmet palliative care needs so that it doesn't take having a pain crisis in the middle of the night and going to the emergency departments to get pain managed, but that so pain is recognized and managed upstream. So that caregiver burden doesn't land families in bankruptcy or result in job loss, but instead is identified up front and families can be supported proactively. And so this is where I think some of this intersection means. We talk a lot at the Center to Advance Palliative Care about integrating a palliative approach, whether it's a specialty palliative care team visiting patients in their home or available for consult in a neighborhood clinic, or whether it is any other health professional interacting with a patient with serious illness who has the training or the workflow or the approach to, again, assess for these unmet needs and connect patients with needed resources. I think palliative care teams often operate in a unique way inside of healthcare because not only are they focused on addressing physical needs of patients, but also in assessing for spiritual need, psychological suffering, social factors that impact patient suffering and patient outcomes. And so palliative care teams very much have the orientation of working with patients and families to understand what are those other factors that are interfering with them being able to cope with that serious illness and live well with that serious illness to the best of their ability. And that, again, maybe shortness of breath, or it may be social isolation, or it may be an inability to get to the pharmacy to pick up medications. And all of those things, palliative care teams consider to be a part of their purview. Palliative care teams working in community settings have a real opportunity to partner. I think the theme of the day has been collaboration, partner with community-based service providers so that if they become aware of the needs of patients and families, they can connect patients or refer patients to services in that community that patients may not have been aware of. So I think there's a handshake there that happens in the ideal situation, too often doesn't happen in reality, where there are opportunities to more seamlessly support multiple domains of patient need. And ultimately, the goal of this work would be to prevent crises so that patients are able to live and cope with serious illness in their communities. So I want to thank Megan for inviting me to join this session. I'll put information about the Center to Advance Palliative Care and my contact in the chat. And we have 5 minutes left for questions for the whole group.
Great. Thank you so much, Bryn. I think that these were such great, I want to say snapshots, but so much deeper and so much more information than just snapshots. So I do want to open this up to anyone who would like to ask a question. You can feel free to put them in the chat or unmute yourself and ask a question of any of our panelists, please.
I'm going to ask a question, if you don't mind. This is Marcy from Washington. They were all really great presentations. I too, Megan, had trouble getting on, so I missed a bit of the first. But my questions are for Jody. Jody, I was thinking that, wondering if you have any social media type things that you can share with us, messages, so that we could share that through our social media, talking about the age-friendly cities or communities.
Specific specific social media campaigns to raise awareness of the site itself. Oh, I'd
Yeah.
be happy to reach out to you after if you want to put your
Okay.
contact info, or I can share it with Megan and she can share it broadly out, because that's a great way to raise awareness. And I also want to mention that one of the things that we're working hard on is thinking about making this site accessible and available to populations in an equitable fashion, because we know that we need to, if we're really going to talk about capturing the voice of older adults, then it has to be all the voices of older adults. And
Right.
And so that's something we'd really love your help on as you're out there thinking like, how could this be useful in my work and how can it align with the work that I'm doing? That's a really important piece of the puzzle for us. And I'd love ideas. If I put my information in the chat, and I'd be happy to share information about social
Great.
media.
And can I just ask you one other thing? I went on quickly, but then I thought it would pull me away too much from the webinar to look at your site.
Yeah.
Can anyone add information about the cities I know, or is there some sort of process people have to go through? Then I noticed people comment, like I looked up Tacoma, Washington, and it's in there, but I just wondered who's the filter that initially filters out whether or not it truly is one of those kind of cities.
Okay, that's a lot of different things,
Sorry.
but I think I know what you're getting at. No, because it's all related. So there is a basic standard page for every city in town, 29,000 of them.
Okay.
And then what happens is that users come to the site and they can rate those cities and towns based upon their perception of its age friendliness. So would you recommend Tacoma, Washington to your older adult friends and families, scale of 1 to 5 in a star rating system? And then we ask them, well, tell us more. Like, why did you rate it that way? And tell us what you think about these domains of age friendliness, because we really want to dig a little deeper when we can. Now, it's not always easy to get people to give us all of that information. So we start on a scale of 1 to 5. That's the typical net promoter score approach in the consumer world. We see that in tons of industries, travel, hotels, plumbers, you name it. Yelp, that's basically what they're doing. So we're saying, why can't we apply this and use that information to better serve the needs of this older adult population, and also supply providers with really awesome, interesting, very, very hard to get feedback from older adults. So that's number one. Users leave the ratings and reviews. When it comes to the content on the page about Tacoma, and I'm not looking at it, so I don't know off the top of my head, but basically we have a claim your page function. So if you are the Division of Elder Affairs for the city of Tacoma, you can apply to claim that page. And there's just a very simple process. We verify. And then you, as the administrator of the Tacoma page, can add a little bit more information. Here's what we're doing. Here's our strategic plan. Here's how you can reach us if you want to get involved. And then notably, it also gives you the opportunity as the administrator to reply back. So if somebody says, Tacoma is an age-friendly city, I don't know if it is, so sorry, but let's imagine that it is. And they say, no, it's not. This isn't, I can never get on the bus. And then you could start a conversation with that person and start to flesh out how we can respond to those pieces of feedback and how we can better serve this population. So it's a way to kind of take a framework which says, what is an age-friendly city? We know that we have a rubric that helps to establish that from the top down, but we've never really had that bottom up consumer feedback loop. And that's what we're trying to build so that we can see, hey, is it true that Tacoma is a great place to grow up or grow old?
Thank you so much. That makes so much sense. And one last thing, it's not a question, but just to say, I'm so glad you're doing this certification for age-friendly employer programs. I was surprised when I started working in public health about 15 years ago, that some of the ageism. And I had worked in mostly for mental health before, and that wasn't the case. So anyway, I'm so glad that you're doing that and that we're trying to raise awareness about that. So thanks.
Thank you.
Thank you, Marcy. Thank you to Alice, who had to leave us early, Kathy, Jody, Bryn, and Jane, and especially for the support from the John A. Hartford Foundation, which makes all of these trainings possible. I really appreciate the work that you are all doing, and my wheels are turning to make additional connections and see additional ways to collaborate and coordinate. If you didn't get to ask a question and you have questions, please send them to AFPHS@TIFA.org, and we will try and get answers for you. We will capture all of the links and share them out with the recording to this session today. So thank you all so much. We will see you next year. Our first session will be the third Thursday in January. I can't remember the date right now, but we will see you then at 3 o'clock with Ageism 2.0. So thank you all very much. Have very, very happy and hopefully very safe holidays.